transverse section of medulla at the level of pyramidal decussation. Here, when we see the spinal cord, in the center it is a H-shaped grey matter. So central, it is a central canal of the medulla that continues with the central canal of the spinal cord. So here we are drawing the grey matter. So this is the dorsal side. So H-shaped grey matter, posterior elongation of the nucleus, posterior horn in the medulla oblongata. So 3 nucleus posteriorly, then we draw the anterior horn. So centrally there is a grey matter and peripherally it is a white matter. Elevation over the nucleus. Here the ventral side, and this is the shape of the spinal cord. So we are drawing the closed part of the medulla oblongata. It is a inferior part of the medulla. It is a narrow part and it shapes like a spinal cord. When we see in the spinal cord ventral part, ventral median part, it is a anterior median fissure in the spinal cord, and posterior part it is a shallow, so it is known as the posterior median sulcus. So anteriorly the deep part is continuous with the medulla oblongata. So here we are drawing the dorsally spinocerebellar tract and ventrally ventral spinocerebellar tract. Here it is a corticospinal fiber in the lateral white column ventral to the posterior horn. There is a corticospinal tract. So fiber from the pyramid of the medulla that crosses to the opposite side in the white matter, that crosses the anterior part of the white matter, then crosses the anterior horn of the spinal cord, and this then goes to the lateral area in front of the posterior horn. So at this level it is a pyramidal decussation. So fiber from the medulla cross to the opposite side and it termed as a lateral corticospinal tract. 75% of the fiber crosses to the opposite side as a lateral corticospinal tract. It is a descending tract. It descends from the motor area of the cerebral cortex to the spinal cord. Function: it controls the conscious skilled movement, especially hand. So it controls the motor movement. So it has a motor function. Central grey matter. So posterior extension of the central grey matter is nucleus gracilis, nucleus gracilis, nucleus cuneatus, spinal nucleus, nucleus gracilis, cuneatus, spinal nucleus. Posterior to this nucleus it is a white matter and it is known as the dorsal column medial lemniscus pathway. So here is posterior median sulcus, dorsal horn, medial lemniscus pathway, posterior white matter. Fasciculus gracilis and fasciculus cuneatus. It is a ascending tract. Fiber of this tract terminate into the nucleus gracilis and nucleus cuneatus in the medulla of the same side. So it is a ascending tract. So function of this tract is conscious kinesthesia or conscious movements. So it has a joint sense, vibration sense, 2-point discrimination, stereognosis and conscious kinesthesia. So these are the function of the fasciculus gracilis and fasciculus cuneatus. There is a separate video for the 3 nucleus of the trigeminal nerve that extend into the midbrain, pons and medulla oblongata. Pyramidal fiber decussates dorsally in the lateral white column as a lateral corticospinal tract, and uncrossed fiber descends in the spinal cord in the lower to the medulla oblongata as a anterior corticospinal tract. So ventrally ventral and dorsally dorsal spinocerebellar tract. These are the ascending tract from the spinal cord to the cerebellum. Ascending tract, spinothalamic tract from the spinal cord to the thalamus. So it carries sensation for the pain, touch and temperature. So ascending tract, spinothalamic tract, there is a lateral spinothalamic tract and anterior spinothalamic tract. We will discuss the ascending tract, sensory tract from the spinal cord to the thalamus to the cerebral cortex in detail in the next video at the sensory decussation in the medulla oblongata. So stay tuned for the next video for the transverse section of the medulla at the level of sensory decussation. So descending tract from vestibular nucleus in the medulla to the spinal cord, vestibulospinal tract. It is related to the unconscious maintenance of posture and balance. Here spinal cord to the olive and then olive send the sensation to the cerebellum. So spino-olivary tract. Tectum of the midbrain. So there is a tectospinal tract. It is related to the controls the movement of head, neck and arm in response to the visual stimuli. And also there is a spinotectal tract. So ascending tract, spinotectal tract, it also related to the head and eye movement towards the source of stimulation.